work in a group gynecological practice called the Astra Women Specialists, and we have specialists who specializes in urogynecology, fetal medicine, and infertility. And my special interest is actually in infertility. So in infertility, we see couples who have got problems getting pregnant. Sometimes it may be just a simple problem in just the wrong timing of coitus or intercourse, or it could be ranging to as more difficult problems such as really sperm abnormality or even endometriosis and tubal blockage. But sometimes it can be very severe, and so therefore we may have to proceed to fertility surgery such as for endometriosis, or to assess the pelvis to see where the problems are and try to correct them as much as possible. But more and more we are beginning to see patients who have got sperm abnormalities. I know it's sometimes difficult for the men to come forward. Often we see the women first, then before we see the men. And of course, during that time, we can actually see the semen analysis, and we can actually be able to see where the different type of semen analysis comes from. So if it's not so severe, then of course we can advise what we call intrauterine insemination, provided that the women have got normal fallopian tubes. And in the intrauterine insemination, we essentially ask the gentleman to produce the sperm, which will then be processed in the laboratory, and then the sperm will then be inseminated into the uterus of the women and allow natural fertilization to occur. Then of course, in very difficult cases such as tubal blockage, severe endometriosis, or sperm abnormality, where natural conception may be difficult, in vitro fertilization or IVF may have to be advised. Besides infertility, there are other common conditions that we see in our clinics, and they are ranging from vaginal discharge to menstrual disorders. And menstrual disorders can come in various types of symptoms, and they can come as prolonged menses, heavy menses, irregular menses, as well as no menses for a long period of time. The role of the gynecologist is to actually help the patients to determine where the causes come from and treat appropriately. A big group of patients that we see in gynecological practice are women in their menopausal age or nearing menopausal age. This group of patients can present with varied types of the symptoms. They may have menopausal symptoms such as hot flushes, they may have difficulty in sleeping, they may have irritability, forgetfulness. Sometimes they cannot cope with it, and sometimes even their husbands complain about that. So we actually provide hormonal replacement therapy for this group of patients. But not all women are suitable for HRT or hormonal replacement, so the role of the gynecologist is to assess which patients are suitable and whether it is really needed or not. Of course, if a woman is already post-menopausal, we still look after them to make sure that they actually age gracefully. It is important to age gracefully. We want to make sure that they are not osteoporotic, they do not have problems of menopause, such as problems of dry vagina or urinary problems that can actually trouble them. So these are some of the gynecological conditions that we see. Antenatal care is an integral part of our gynecological practice. And then in antenatal care, we look after our pregnant mothers from as early in the first trimester to the third trimester, and then we bring them on to help them to have a smooth delivery and labor. It is important that they come early in the pregnancy because the Down syndrome screening tests are available as early as about 11 to 14 weeks, which is actually the first trimester screening test. Newer tests available are the NIPT or the non-invasive prenatal test, where we actually take blood from the mother and the placental cells which enters into the maternal bloodstream are being extracted out, and from there we can screen for Down syndrome to the detection rate up to about 99%. If it's positive, the tests are positive or what we call high risk, then of course it is important to confirm whether it is Down syndrome or not.